Good evening. Am I
Good
audible?
evening, sir.
Good
Very good
evening,
evening.
sir.
Good evening, sir.
Good evening.
Happy Pongal, happy Makar Sankranti, happy Uttarayan to everyone.
Same to you, sir. Thank you.
Thank you, same to you, sir.
Good evening, sir.
So let's discuss the classification of the spine. Then we can keep on discussing homework in the previous way, right? So let's now we have very wonderful idea that how to do the classification of the human body. अब हमें पता चल चुका है. So now we can learn this, the classification of the spine easily. So whenever we are doing classification of the spine, we always start from the bottom. Yeah, हम हमेशा bottom से start करते हैं. So what is the meaning of bottom? I will tell you. So there are 6 energies: wind, heat, hotness, humidity, dryness and coldness. हमारे पास 6 energies होती हैं. There are 6 energies, right? So let's see here. I will show you the spine. I have treated many patients successfully by using this classification when the person was suffering with the various type of the spine problem. So I am taking you to spine. So we can see in the spine, there are many vertebrae. This is the cervical spine, C1, C2, C3, 4, 5, 6, and 7. So there are 7 vertebrae in the cervical spine. C1, C2, C3, C4, C5, C6, and C7. Then we are coming to the thoracic vertebra. From thoracic vertebra पर आते हैं. Let's see here. So look at the thoracic vertebra. There are 12 thoracic vertebrae. So this is the T1. We can see T1. You can see this T1. The how every vertebra looking like. If you want to see that, कि कैसे vertebra दिखते हैं. Okay. I will show you every vertebra. That how to each vertebra looking like. See, this is the vertebra. So these are T1 or the thoracic one. Then thoracic 2, 3, 4, 5, 6, 7, 8, 9, 10. We can see how the thoracic vertebra are moving down. कैसे नीचे की ओर झुके रहते हैं. So there are total 12 thoracic vertebrae. Okay. So this is the T1 to T12. So T2, T3, T4, T5, T6, T7, T8, T9, T10, T11 and T12. So there are total 12 thoracic vertebra. कुल 12 thoracic vertebra होते हैं. So this is the T11 and T12 till here. Then the lumbar part is starting, lower back is starting, फिर हमारा कमर स्टार्ट होता है. So we can see this, the L1, lumbar 1, lumbar 2, lumbar 3, 4 and 5. So there are 5 lumbar vertebrae. L1, L2, L3, L4 and L5. We know the lumbar problem are very common. People are suffering with the lumbar spondylitis, spondylosis, and the various other problems of the like cord compression, nerve compression. कई प्रकार की प्रॉब्लम हो सकती हैं. Okay, so after the lumbar vertebra, if we are going down, अब हम नीचे की ओर आए. So we can see this is the sacrum. So this is the lumbar 5, and after the lumbar 5, if we look at down, we can see the sacrum bone here. So this is the sacrum. The 5 bone getting fused together and becoming one. So we can see the multiple sacral foramina. हम कई सारे sacral hole देख सकते हैं. Hole means the junction where upper and lower bone has fused. So this is S1, S2, S3, S4 and S5. All the 5 bone got fused and became one. From these whole nerves are coming out. So these sacral is very much important. बहुत महत्वपूर्ण है. So we are telling sacral is a one bone and which is made by the fusion of 5 vertebra. 5 vertebra got fused and became one. 5 vertebra fuse हो गई और एक बन गई. Then we are moving down. Now tailbone. So this is a tailbone. Again, you can see how many bones are fused. There are 4 bones got fused and became one. So this is the tailbone or the coccygeal bone, coccyx. So coccyx 1, coccyx 2, coccyx 3 and coccyx 4. The 4 vertebra got fused and became one bone. So this is called coccyx bone or the tailbone. So this is the entire spine. And we know the spine is very important structure of the human body. हमारे शरीर का ये vertebral column बहुत ही महत्वपूर्ण structure है. This vertebral column is a very very important structure. This bony part is very important structure because from this bony part spinal cord is passing. इसी bony vertebral canal में से हमारा spinal cord pass होता है. Spinal cord. So now many persons suffering with the problems of this spine. So first, as per the classification, suppose I want to do the treatment of the spine. अगर मैं treatment करना चाहता हूँ spine का, suppose I want to do the treatment of some vertebra, some bone. Okay, we already know. Now I will take you to our classification number 1 of सुजोग 6 की. हमारे सुजोग 6 की का जो क्लासिफिकेशन है. So what is the meaning of bones? Bone का मतलब क्या है? So let's see this classification. Step by step we'll be moving. The entire body we can divide in 6 parts: wind, heat, hotness, humidity, ड्राइनेस एंड कूलनेस। संपूर्ण शरीर को हम 6 सिस्टम में बांट रहे हैं। सो विंड मीन्स मस्कुलर सिस्टम हु इज डूइंग लॉट्स ऑफ मूवमेंट। हीट मीन्स सर्कुलेटरी सिस्टम, ऑल द blood, artery, veins are coming under that. Nervous system, hotness. Then the digestive system, then the skin, then the bone system. Right now, let's start with the bone system. Okay, because we are targeting first, we are thinking about the vertebral column. We are talking about the bones or the vertebra. So we want to focus on the bone. As per the 6th classification, bones means coldness. हम bone का मतलब है coldness. So first selection will be coldness. It means we are giving the message that I want to treat bone. Okay, good. But there are too many bones in the human body. Which part of the bone you want to do the treat? हमारे शरीर में we have bone in the front part of the body, back part of the body, right side of the body, left side of the body. We have bone in the arm, in the legs, everywhere we have bones. So body is full of bones. So now we'll do the second classification. As per this classification, what we'll do? अब हम दूसरे क्लासिफिकेशन की ओर जाएंगे because we have to move step by step. So now I will take you the classification number 2. This is the very good classification, and this is the classification number 2. Bend means I want to do the treatment of this leg. No, I don't want to treat this leg right now. Heat means I want to do the treatment of this arm. No, I don't want to treat the arm right now. Hotness means I want to treat the head region. No, I don't want to treat the head region. अभी मुझे head का इलाज नहीं करना. Okay. The dryness means I want to treat the other arm or the right arm. No, I'm not targeting the right arm. Okay. Coldness means I want to treat the right leg. No, I don't want to treat the right leg. I want to treat this middle part. This part I want to treat. So what is that? That is humidity. As per the 6th classification, we already have discussed earlier. हम इस बारे में पहले ही बात कर चुके हैं. I want to focus on this part, this entire torso, front or back. Right? Either the front or the back. So my first message, okay, I want to treat the humidity. It means I want to treat something here in this part. कुछ ना कुछ इस part में. Right? I don't want to treat the legs. I don't want to treat the arm. I don't want to treat the head. I don't want to treat the right arm. I don't want to treat the right leg. I want to treat the only humidity part. So my first selection was coldness, means bone system. Now my second selection is humidity, means torso. This part is called torso. Okay, wonderful. At least we have cancelled arm and legs. But in the torso also we have too many bones. हमारे torso में भी तो कितनी सारी bones हैं. Look at here. We are having a sternum bone in the front part. We are having ribs laterally. We are having collarbone. Okay, we also have ribs posteriorly. We have scapula bone. In this torso parts also we are having too many bones, but our focus is spine. So now we'll move to the another classification. अब हम third classification की ओर बढ़ेंगे and we'll give the message, oh no, I just want to work on the back side of the body. My target is just only back side of body. So I am showing the classification number next. Yeah, look at this. So this is my another classification. I have divided the body in the 6 energies. Now, this front part is coldness. Then going to the left side, this is the heat. Sorry, wind. This is the wind, because wind is in the left side. Then left side only, but moving to the back, heat. Now spine. Spine means hotness. The central part is hotness. Hotness. Then other this part humidity. So right side, I'm reaching to the right side, but on the back humidity. Humidity will be in the right on the back. Now moving in the circle, coming to the front side, dryness. So this is the dryness, right side. And again, I'm reaching to the coldness. So this is the hotness, the center part of the hotness. So I will put this hotness point, means I just want to treat here. I just want to do the treatment here only. So my first selection about coldness means I want to work on the bone system. But in the body, we are having too many bones. My second selection was humidity. Means I want to work on this area, in this area means torso. My third selection will be hotness. I just want to work where we have spine, means back central. Now I reach to the spine. Now this is the 3 things we have to take first. So coldness means bone system. Humidity means torso. Hotness means the back central. Okay. So this is the journey. ये हमारी journey है. Journey till the spine. So coldness means bone system. Humidity means the bone of the torso. And hotness means now in the back part. Okay, 3 things we have to start with. हमें 3 जगह से पहले start करना है. Now we reached on the spine. Now, if you want to treat the entire spine, it's okay. The person is having pain in the entire spine. Pain in entire spine. So first we'll do the treatment of pain of the entire spine. Then we'll go part by part. Pain in the cervical or lumbar. Okay. Step by step, let's move ahead. So my first question, now I want you, all of you, solve with me pain in the entire spine. Okay. पूरी spine में दर्द है. And the nature of pain is maybe dull pain. Dull pain. Now you should remember what is the meaning of dull pain. बताइए dull pain का मतलब क्या है? As per the 6 energies, what is dull pain? Everyone reply. So as per the 6 energy concept, pain might be having many different types. Okay. And if we talk about the dull pain, so dull pain is in the 5-element cycle, the humidity is creating dull pain. Dryness is creating acute pain or sharp pain. And coldness is creating very severe pain. So this is the humidity, dryness and coldness. So dull pain means humidity is plus plus. So we have to calm down the humidity. We have to sedate the humidity. That is our prime goal. So now use the double grandmother law. All of you are practicing this double grandmother since many days. Now, please make the formula. I am making formula slowly. You also make your own formula because we have discussed this double grandmother formula many times. So here I am making, or you can reply with me, bend, heat, hotness, humidity, dryness, and coolness. Okay? Or we can tell wood, fire, earth, metal, and water. So humidity is plus plus. We want to control the humidity. We want to sedate the humidity because of dull pain. Now, as per the double grandmother, we will see who is the grandmother of humidity. Tell me, who is the grandmother of humidity? Yes. So wood is the grandmother of humidity. Who can control? Wood ही grandmother है इसकी. So now very simple. Sedate humidity and tonify wind. Because grandmother is doing always opposite action to control the grandson. So sedate humidity and tonify wind. So this is my first grandmother. But remember one thing, grandmother is just opposite. If you're sedating the humidity, definitely you have to tonify the grandmother, means wind. Okay, but I'm talking about the double grandmother. So now, who is the grandmother of wind? Can you tell me now? Tell me, everyone. Yes, right. So who is the grandmother of wind? Wood. Yes, so metal. Metal is the second grandmother. Metal second grandmother. Grandmother always do opposite action. So what action is happening here? Just do the opposite action there. Wind tonification is happening here. So sedate the dryness. So grandmother number 1 and the grandmother number 2 together, this is called double grandmother law. So what is formula? Here we will sedate dryness. So this is called double grandmother law. Or control cycle, treatment by control cycle, or treatment by subjugation cycle. Subjugate means control. Who can be done by the grandmother? Right? So the final formula will be humidity sedation, wind tonification, dryness sedation. What is the main action here? The main action is humidity sedation. The main action always should be remembered. हमारा जो मुख्य एक्शन ह्यूमिडिटी सेडेशन है, बाकी तो सब बाद में आए. So this is the treatment. So again, I told you, select first coldness. Coldness means bone system. So I will write here coldness. Coldness means C. Then I am choosing torso. Torso means humidity, as I discussed with you. So now I am writing humidity is my second selection. But in the torso, we have to read just spine. So I want to go on the back side. So now third, only back, central, or the spine area. So that is hotness. My third selection will be hotness. This is just a journey. We are not doing any treatment. ये हमारी सिर्फ journey है. We are just taking step. So from the coldness, we are going to the humidity. From the humidity, we are going to the hotness. We reached on the hotness. This is just a journey. Finally, we reached on the hotness. So treatment will be on the hotness. Finally, wherever we reach, there will be treatment. What is the treatment? Humidity sedation, bentonification, dryness sedation. Humidity sedation, bentonification, dryness sedation. Okay, this is the treatment. Again, I will tell you. First, we have selected the coldness. Coldness means bone system. Then I selected torso. Torso is humidity. If you remember this classification, bend, heat, hotness, humidity, dryness and coldness. So this is the humidity, entire area. Then hotness. Hotness means spine area. We always put renting sign here. The journey, renting sign. Right? Finally, we have reached on the hotness. So we are doing treatment of the hotness. Let's do the treatment. चलिए एक बार plan करते हैं. So right now I am treating entire spine. अभी हमारा लक्ष्य है पूरी की पूरी spine को treat करना. If you are able to treat the entire spine, then definitely you will be able to treat single part. I hope if you go step by step, it will be better for you. Don't worry, we are going to discuss everything about the spine, but step by step. So let's plan the treatment now. Yes. So we will plan the treatment here. Step number 1. So we have all the magnets here. We have a star magnet. This is a star magnet, right? We have dual magnet like yellow. If we see yellow from the top, that is sedation. We have dual magnet. If the white from the top, it's tonification. So we have all the magnets here. Now I am starting the treatment. I have collected all the magnets. See, all the magnets. Okay, let's start. Okay, let's start the spine with the, what is the first? Coldness. If we start in the yang. So which meridian is the coldness meridian? Coldness meridian कौन सा है? बताइए. Tell me. So let's select the urinary bladder, which is the coldness meridian. So my first step is I'm writing coldness. C. Yeah. Okay, good. In the coldness, I want to go in the torso. अब मुझे torso पर जाना है. अभी मैंने आपको बताया as per the classification. What is torso? Humidity. So in the second step, I will go in the humidity. So in this UV meridian, this is the humidity point. We can see visible with the yellow color. I will put the star magnet here. This is the star magnet. I am putting the star magnet on the humidity. Now, as soon as I put the star magnet on the humidity, so humidity meridian will open. Humidity meridian means stomach meridian. So this the stomach meridian will open. So after the humidity, now I will, whatever treatment I will do on the humidity. अब मैं जो भी ट्रीटमेंट है ह्यूमिडिटी में करूंगा. What is the step number next? In the torso, I have to go to the back side. What is back side? Back side क्या है? बताइए. Very good. That is the hotness. So back side is the hotness. So this is the humidity meridian. In this, I will, where is the hotness point? This is the hotness point at the bottom. I will take one star magnet and I will put in the hotness. So this is the hotness point. As soon as I put the hotness point, hotness meridian will open, and this is the hotness meridian. We can see here. The triple warmer is the hotness meridian. So I reach on the hotness meridian. Now whatever treatment I will do in the hotness. So this is the, now I will do the final treatment here. So now the final treatment will be happening here now, wherever I am reaching the last. Got it? On the hotness. So what is the treatment? Dull pain. Dull pain we discussed. What is dull pain? Dull pain is humidity plus pulse. So humidity is sedation. So I am sedating the humidity. Okay, humidity is sedation. Then bind tonification. I am tonifying the bind. Then dryness sedation. Remember what we have discussed earlier. Dryness sedation. तो ये हमारा हो गया. हमारा मेन एक्शन क्या था? And all three, what is our main action? So remember the main action, because main action will become controller and the super controller. Humidity sedation, we'll see in the last. The humidity sedation, because it's the main action, it will become controller or super controller. So first focus on the treatment. So humidity sedation will take the yellow magnet, and we are going on the triple bottom meridian. हम triple bottom meridian में पहुंच ही गए. We are going to do the treatment, the hotness, humidity sedation. So we'll put the magnet on the humidity point, sedated. Next, bind tonification. We'll take the white magnet visible from the top, bind tonification. So we have tonified the bind here. Now, dryness sedation. Again, we'll take one more yellow ball magnet visible from the top. This is the dryness sedation. So we have put 3 points in the triple bottom meridian. The main treatment is over. Main treatment हो गया. Our main action was humidity sedation. So we'll take in the controller. So controller is itself the triple warmer. ये तो हमारा triple warmer ही है. So we already have sedated the humidity. So no need to do once again. Then the super controller will be thumb. So we'll sedate the humidity there. Thumb हमारा हमेशा super controller है. So we'll take the yellow magnet and we'll put in the thumb. That is humidity sedation. So this is the final treatment. Over. I think it's clear to everyone. So this was the treatment of entire spine pain. अब कलर के बाद आप सोच लो, है ना? कलर के हिसाब से आप सोच लीजिए. अभी हम एक चीज को लेके चलेंगे, राइट? We are taking one thing because color we have discussed multiple times. Right now we are going to take one thing because we have to discuss each and every part of the spine, or we will discuss color also after. But you know already. If you want to sedate now, use the color opposite color. Which is opposite color? Tell me. The color of grandmother and the grandson is the opposite color. If you want to sedate, use the opposite color. Clear? अगर हमें सेडेट करना है तो अपोजिट कलर यूज करिए। अपोजिट कलर का मतलब है ग्रैंड मदर का या ग्रैंडसन का। एंड इफ यू वांट टू टोनिफाई यूज सेल्फ कलर। Got it? You know that already, but right now we are discussing with the magnets because after few sessions we also have to discuss with the seeds, and I will tell you seeds are more effective than the magnets. But if the concept is developed, then we can use seeds also. Especially I will tell you about the beet seed, गेहूं के दाने, that is more effective than the magnets. Okay, if the magnet bringing the effect after a few hours, the beet seed will bring the effects after few minutes. That much effective. But what is happening? Because if it is more effective, you do something wrong, it will also bring the wrong effect very fast. That's why I'm not using beet seed right now. After a few sessions, we'll also start using beet seed, right? Okay. So, okay. Now, so I think it's clear now. I am moving to the individual part of the spine. So the next classification, we are going to discuss the individual part of the spine because right now we have treated this entire spine. So look at this classification of the spine. If we divide the spine in the 6 energies. So always remember yang in the upper side and yin in the lower side. There are 3 levels of yang: wind, heat, and hotness. And there are 3 levels of yin: humidity, dryness, and coldness. If you don't want to confuse yourself, always start from bottom. So in the bottom, if you are going to the top, coolness will come. Then the dryness will come. Then the humidity will come. Then wind will come, heat will come, and the hotness will come. So this is the sequence. Always start from bottom, especially for a spine. Then there will not be any confusion. Okay. Okay. So now I would like to tell you about the spine first. हम आपको spine के बारे में बताएंगे अभी. So look at the spine here. Entire spine. We are dividing in the multiple parts because we have to divide the spine in the 6 energies. So we are making the boundary here. हम boundary बना रहे हैं. Boundary will we are making at the thoracic level. So this is the boundary. Upper is yang and lower is yin. Okay. So let's start from the lower. So number 1, if you see the lower, so this tailbone will be tailbone and the sacrum bone together. This sacrum bone so again, the lower part is yin. We are doing the classification of the spine, and the lower part will be yin. So the tailbone is the first. This tailbone. Or the coccyx bone in the bottom. So this is coldness. So this is the coldness. Okay. Now we are coming to the sacrum bone. अब हम sacrum bone की बात कर रहे हैं. Let's move to the sacrum. So this is the sacrum bone. It is dryness. So coldness, dryness and humidity. Humidity means lumbar area. We know nowadays too many people are suffering with the lower back pain, lumbar spondylosis, lumbar cord compression, slip disc, nerve compression. Everything need a different treatment. So we have to understand step by step. So this is the humidity. So yin is over. Humidity, dryness, and coldness all together are called yin. So humidity means lumbar area, lumbar 1 to lumbar 5, L1 to L5, that is humidity. The dryness means sacral area, means S1 to S5, that is dryness. Then the coldness, coldness means coccyx 1 to coccyx 4. So remember very simply, lower part we have divided in the 3 energies. In the upper part also we'll divide in the 3 energies. हम upper part को भी 3 energies में divide करेंगे. So this is the bend. We know that yang bend. So entire thoracic spine will be bent. In the thoracic spine we have T1, T2 to T12. All the thoracic vertebrae are coming under the bend energy. Because now we'll go to the up. So cervical spine will be heat. Means C1 to C7. All the 7 vertebrae are coming under the heat. And what is the hotness? Hotness means the junction. This junction with the skull. Junction with skull. That is hotness. That is called AO junction. AO junction. A means the first cervical. The AO means atlanto, occipital junction. Atalanto means C1. The name of C1 is Atalanto, Atlas. The C1 is called Atlas. And occipital means this is the occipital bone. Just remember it simply, we are not using this upper AO joint most of the time. Most of the time we are using other energies here. ज़्यादातर हम other energies का प्रयोग करते हैं because most of the time we are using the pain of the tailbone, pain of the sacrum or the problem of the sacrum, problem of the lumbar vertebrae, or maybe thoracic vertebra and the neck. That's it. We don't go in the AO. So don't get confused with the AO. Just remember this thing very simply. So I will again write in a very simple manner here. So how to divide the entire spine? Doing the division from here. So bend, heat, and hotness. Humidity, dryness, and coldness. Done. Now, suppose I want to do the treatment of lower back pain. I want to do the treatment of this part, lower back pain or the humidity area. मुझे lower back pain का treatment करना है. I want to do the treatment of the humidity. Because first we are doing the treatment from entire lumbar area, means L1 to L5. Then we learn that how to do the treatment of L3, L4. or individual vertebrae. But right now, I want to do the treatment of the entire lumbar spine. We know the lumbar pain is very common. Suppose I want to do the treatment of the neck, only neck. Or I want to do the treatment only of the tailbone. So how to plan the treatment? Let's discuss humidity or the lower back pain. So again, let's start from here. First, I will do the selection as per this classification. What is this classification? I want to do the treatment of the bone system, which is coldness. So first I will select the coldness, C. But there are too many bones in the human body. हमारे शरीर में तो बहुत bones हैं. So my second classification, okay, I want to just go in this area, humidity area. So my first selection was coldness, means bone. The second selection, only the humidity area, means torso. But in the torso also there are too many bones, ribs, sternum, collarbone, there are too many bones. In this area also there are too many bones. I just want to go in the spine. मुझे सिर्फ spine में जाना है. So now I will do this classification, and with the help of this classification we will go to the hotness area. So first was coldness, means bone, then the humidity, now hotness. I reached to this area. But I don't want to treat entire spine. I just want to treat the lower back, which is humidity. So my next will be humidity. Now I reach to the lumbar area. मैं lumbar area पर पहुंच गया. So first I selected the coolness. Which is bone system. So I will write coldness here. Then I selected torso, means humidity. But in the torso also back center. That is hotness. But I don't want to treat the entire spine. Back central means spine area. I just want to treat the lower back, lumbar area. So now I will choose humidity. So finally I reached in the humidity. So first I taken the coolness, then humidity, then hotness, then humidity. Now finally whatever treatment I will do on the humidity. अब हम जो भी ट्रीटमेंट करेंगे हम ह्यूमिडिटी पर करेंगे. This will be the final treatment place. So one person is suffering with the acute pain. We know the dull pain is humidity. Acute pain is the dryness, and the severe pain is coldness. So dryness. So dryness is plus plus. Okay, I want to do the treatment of acute pain. So now again apply the double grandmother law. Wood, fire, earth, metal, and water. I want to sedate this. This is my main action. I want to sedate dryness. This is my main action. Can you tell me who is the grandmother of metal? Grandmother कौन है metal की? Please tell me. Yes, right. The grandmother is the fire. So if you want to sedate dryness, you will do opposite action on the fire. You will tonify heat. So this is the first grandmother. Because on the grandmother, we always do opposite action. So dryness, sedation, and heat tonification. And here main action is, remember, dryness sedation. Now, who is the grandmother of fire? Water is the grandmother of fire. So water is the second grandmother. Water is the grandmother of fire. So whatever we are doing here on the fire will do opposite action with the grandmother. So we are tonifying the heat, so we'll sedate the coldness. Because on the grandmother, we always do opposite action, sedate coldness, done. So dryness sedation, heat tonification, coldness sedation, this is our final treatment. So let's plan. चलिए साथ में करते हैं. Now again, be ready and you have to tell me as per I ask. आपको फिर से मुझे बताना होगा. As I will ask you, you have to tell. Okay. So my first step. Okay, I'm again collecting all the magnets here. These all are various magnets. Yeah. So a step number one, selection of the coordinates, bone system. In the bone system, number one, what I have to choose. First, I am selecting the coldness. The coldness means bone system. In the coldness, I have to select torso. Torso means humidity. So in the coldness, I will go to the humidity and I will put the star magnet. As soon as I put the star magnet or the humidity meridian will open, stomach meridian will open. Okay. Now my second step, in the torso, I want to go in the spine area. So already stomach meridian is open, humidity meridian is open, but I want to go in the spine area. Spine area is hotness, as we discussed. So in the stomach meridian, I will be putting one star magnet on the hotness. This is the lower point is the hotness. I'm doing the same what I have did earlier. ये हमने लगा दिया. As soon as I put the star magnet to the hotness or the triple wire meridian will open. And I reached on the spine. The triple warmer meridian or the hotness meridian open now. But I don't want to treat the entire spine. I want to treat the lumbar area. Lumbar area is humidity. So I will take star magnet and I will put on the humidity. This is the humidity point. I am putting the star magnet here on the humidity point. As soon as I put the star magnet on the humidity, again humidity meridian or the stomach meridian will open. So I will put the humidity point here. Now I reached on the humidity, I reached on the lower back, the final treatment will be happening here now. अब हमारा जो भी फाइनल ट्रीटमेंट है यहीं पर होगा, ह्यूमिडिटी में होगा. What is the treatment? We already planned dryness sedation. Then heat tonification. Then coldness sedation. This is the final treatment. What is the main action? Main action is the dryness, which will become controller and the super controller. जो भी हमारा मुख्य एक्शन होगा वही हमारा कंट्रोलर और सुपर कंट्रोलर का काम करेगा. I'm just writing controller, but you should understand controller and super controller both. Let's start. So look at here. In the humidity meridian, we have to make the final treatment. So dryness sedation, where the dryness point? Dryness point is here. So take the buell magnet and putting on the dryness point or dryness sedation. We can see this is the dryness point. Then heat tonification. So we are taking the buell magnet and we are tonifying the heat point, heat tonification. Now the coldness sedation. We'll take the buell magnet and putting in the coldness point. The coldness point in the top we can see. The upper point is the coldness sedation. Treatment is over. What is the main action? The main action is dryness sedation. So we'll do in the controller. Control is the triple warmer. So we'll do the dryness sedation, which is the main action in the controller. And the same thing we'll do in the super controller. Super controller means thumb, dryness sedation. Done. कितने लोगों को समझ में आया ये ट्रीटमेंट लोअर बैक का? How many percent understood? And I think you understood because since many days we are practicing, so it will be easy for you, right? We'll go to the disc bulge also, don't worry. See, it's easy now because we are discussing step by step. If directly I will go to the L4, L5 slip disc, it will be confusing. First, we have selected all entire spine. Then we have selected only lumbar area. Now your homework. You have to do the treatment of acute pain in the cervical spine. Write down. This is a homework. Write down. So what is the homework? Then tomorrow I will be going in the deeper aspect and I will be discussing various problems. So acute pain in cervical spine, entire cervical spine. Now question number 2, very severe pain in thoracic spine. And question number 3, dull pain at tailbone. 3 questions, right? Question 1, question 2, and question 3. So do this, then we'll discuss these 3 questions and we'll go in the deeper aspect of this treatment. Not able to hear. Yeah. Please again. Yeah.
अभी जो हमने किया लोअर बैक पेन का, the main action will be on hotness meridian, right?
So what is the main action that will be on that controller and the
So it will be on triple warmer meridian, or you have taken it on stomach meridian?
No. You are asking about the last treatment?
Last what we did, na lumbar area treatment, what we did.
So lumbar area means finally we reach on the humidity, right?
So see, we take coldness for bone system, humidity for torso, and we take hotness for spine, entire spine. And then we have to choose lumbar, so humidity meridian.
Yeah. So
that is why we are doing the treatment on stomach meridian.
Yeah, perfect. All right. Got it?
Okay. Okay.
Okay, fine. So now please do the homework so that you can memorize everything in your subconscious mind. So we can move easily. And we will discuss all the things like slip disc and the spondylosis, spondylitis. Everything needs different treatment, right? So we'll discuss everything. So see you tomorrow. So have a wonderful day. And now see you tomorrow. Please do the homework. And we'll continue the class. Thank you so much. Closing the session.